I am Dr. Ashley Pullen, and I work for the Main Street Family Medical Clinic in Madison, Mississippi. My philosophy on patient care is really just about a nurturing relationship. I really enjoy spending time with my patients. I actually see a lot of the times all of their family, and just really taking that whole patient, and my goal is to make them feel better. I'm a mother, so by nature I'm a nurturer, and I tend to bring a lot of that into my family practice. I'm from Greenwood, Mississippi, where I was born and raised. Left there to go to college at Delta State University in Cleveland, Mississippi. Stayed there for 4 years, got my Bachelor of Science in Mathematics, Biology, and Chemistry, mainly because I couldn't decide which one to choose. Ended up in pre-med because I enjoyed helping people. I feel I'm very outgoing and really like talking to people, and medicine just allows you to interact so much with so many different people that it just seemed like the appropriate choice for me. And so I went to medical school, so moved to Jackson, Mississippi, my husband and I, and went to the University of Mississippi Medical Center for 4 years and picked family practice as my next step. And so for residency, stayed at the University of Mississippi for my residency for 3 years, and have been with Baptist for now 5.5 years since I left the university. In the morning I get up and I'm like, how many people will I help today? Is it going to be 30? Is it going to be 40? You know, somewhere in between. And so each morning I get up just waiting to see what's going to come through the door and how I can make people feel better. I have 2 children. My son will be 10 this summer, and my daughter will be 7 next month. And my son is special needs. He has a language delay, and so I spend lots of time after work helping him catch up on all the things that he has behind and delayed. Also, aside from that, I have hobbies that I enjoy as well. I sew and I make kids' clothes. And in my spare time, not doing other things with my family, I test patterns for people who make children's clothing patterns. And I also play tennis. I love practicing medicine because it allows for me to each day get up and to make a difference in someone's life. I get to help make them feel better, whether it's their emotional well-being or it's their physical well-being. I just really enjoy walking into a room and walking out of a room feeling that that person has felt a fulfillment or that they have had a change from walking in here. I have students who rotate with me often, and the one thing that I give them before they leave is to make sure they always listen to their gut feeling, if that makes sense. I feel that gut feeling is like God telling me that there's something specific that needs to happen while I'm there. Whether it's a specific test I need to order because of something that they've said, or it's something in particular I need to talk to them about, even if it's not something that they brought up. I'm not a counselor by nature, but sometimes I feel that I walk out of that room and I've said things that I couldn't have said on my own. And so I feel like sometimes I just get to speak to people and make a difference. The most gratifying part of my work really is just the relationships. And when the patient leaves and they're happy and they want to hug you, or they bring you chicken eggs. I mean, they just, whatever. I have a patient who brings me vegetables all the time. I have turnips laying outside the back door quite often. But that's the gratifying thing, I think, is just really the relationships you have with your patients, and just knowing that the two of you have a bond that's just unlike any other. The Baptist mission has been about healing physically and spiritually, and that has been my mission as well. And so I feel together we work as a really good team, to bring both of those things for our patients.